Good day to all of you. Welcome to Vcodemy. So today's topic is, as you can see, colonoscopy. How do you code colonoscopy easily? It is a vast subject and slightly intricate, but let me try to capture most of the info for you. A colonoscopy is a procedure that lets your healthcare provider check the inside of your entire colon, meaning large intestine. The procedure is done using a long flexible tube called a colonoscope. The tube has a light and a tiny camera on one end. It is put in the rectum and moved into the colon. So as you can see in the picture, starting from the rectum, it moves into the sigmoid colon, descending colon, then into the transverse colon, and then the ascending colon. So this comprises the large intestine. So ending in the cecum, and then you have the small intestine. So till the end, the tube will be moving till the end of the large intestine. For the definition of colonoscopy, do check the CPT book. Colonoscopy is the examination of the entire colon from the rectum to the cecum and may include the examination of the terminal ileum or small intestine proximal to an anastomosis. So when performing a diagnostic or screening endoscopic procedure on a patient who is scheduled and prepared for a total colonoscopy, if the physician is unable to advance the colonoscope to the cecum or colon, small intestine anastomosis due to the unforeseen circumstances, report 45378 colonoscopy or 44388 colonoscopy through stoma with modifier 53 and provide the appropriate documentation. So this is an important definition. So there are different types of colonoscopies which are done. So what is the purpose of the colonoscopy? So does the patient exhibit any symptoms, or is it just a simple screening colonoscopy? And coming to the colonoscope which is used, for example, a sigmoidoscope. There are different types of sigmoidoscopes like rigid sigmoidoscope, flexible sigmoidoscope. A rigid sigmoidoscope is 25 centimeter long and it allows the examination of up to 20 centimeter of the rectum and colon. Flexible sigmoidoscope, it is made up of flexible fiber optic tube and can be up to 60 centimeter long. It allows examination of the descending colon also. This is for the sigmoidoscopy. So first you need to read the chart and find out if it is a diagnostic versus a screening colonoscopy. How do you differentiate? So as you can see in the slide, the patient may have some symptoms like rectal bleeding, constipation, intermittent diarrhea, abdominal pain, etc. These are called the symptoms which a patient will commonly exhibit. A screening test is a test provided to a patient in the absence of signs or symptoms. A screening colonoscopy is a service provided on a asymptomatic patient for the purpose of testing for the presence of colorectal cancer. In short, it is abbreviated as CRC. Or you can even detect the colorectal polyps. Whether a polyp or cancer is ultimately found does not change the screening intent of that procedure. So this is how you find out. This is a screening colonoscopy. The patient should not have any symptoms. Diagnostic colonoscopy, on the other hand, is a test performed as a result of an abnormal finding in the lab test like anemia, sign or symptoms such as abdominal pain, bleeding, rectal bleeding, diarrhea, etc. So presence of symptoms means a diagnostic colonoscopy. So here you can see the code ICD codes K62.5 is for the rectal bleeding. Symptoms like rectal bleeding are abnormal findings. A colonoscopy is needed to find out the cause of the bleed. So you can see colorectal cancer CRC. Colonoscopy is mainly used to detect colon cancer in the earlier stages. So then it is fully cured if it is detected in the early stages. If it is advanced stage, then the prognosis for the patient will not be so good. Medicare has lowered the minimum age for colorectal cancer screening for Americans from age 50 to 45 for certain tests. Also expanded the definition of CRC screening tests and new billing instructions for colonoscopies under certain scenarios. So they have brought down the age where the patient is eligible for a colonoscopy from the age of 45. You don't have to wait until 50. You can use the CPT code 45378, which is colonoscopy flexible proximal to splenic flexure, and it is diagnostic. The intent is diagnostic with or without collection of specimens by brushing or washing with or without colon decompression. Separate procedure. However, if polyps are removed, use the appropriate CPT code 45380 84 45385 45388. 45380 is for biopsy of single or multiple lesions. 45384 is for colonoscopy with removal or tumor or polyps or other lesions by hot biopsy forceps. 45385 colonoscopy flexible with removal of tumor, polyps or other lesions by snare technique. 45388 is colonoscopy flexible with ablation of tumors, polyps or other lesions, includes pre and post dilation and guide wire passage when performed. And also you need to add modifier 33 preventive services to each CPT code submitted on the claim. If modifier 33 is not added, the colonoscopy will not be recognized as a screening service and the patient will be inappropriately billed. For proctosigmoidoscopy, you can use the code CPT code 45300. For a simple sigmoidoscopy, 45330. 45378, which is colonoscopy, if it reaches the cecum, fine, you can bill it. But due to some reason, the physician is unable to pass the scope beyond, for example, beyond the descending colon due to poor presence of stools in the colon, then you have to stop the procedure. Unable to pass the scope to the cecum due to prep. So then 45378, you will be appending the modifier 53. Discontinued procedure. 53 is for discontinued procedure, and you also have to enclose the appropriate document. What is the reason for discontinuing? So coming to the question in your mind, why do you need a colonoscopy at all? So there are various reasons. So common diagnosis codes for colorectal cancer in screening include Z12.11, which is encounter for screening for malignant neoplasm of colon. So this is a screening colonoscopy. That will be the first diagnosis, primary diagnosis. Z80.0 is family history of malignant neoplasm of the digestive organs. By family, they mean the parents, siblings, or the children of the patient. Then you have Z86.010, which is personal history of colon polyps. So these are the different reasons for colonoscopy being ordered for the screening of the patient. Apart from this, if the patient displays symptoms, as we mentioned before, like rectal bleeding, abdominal pain, extra, and they are finding out what is the reason for this symptoms, then it becomes a diagnostic colonoscopy. So a small information for you: ulcerative colitis always affects the large intestine, whereas Crohn's disease affects the small intestine. So both these diseases affect the colon, but the starting point for ulcerative colitis is the large intestine, whereas Crohn's disease usually affects the small intestine. So that's the difference point. So hope all of you are following me so far. So let us look at a clinical scenario. So what we have learned so far, let us apply it. A 70-year-old Medicare patient calls the surgeon's office and requests a screening colonoscopy. The patient's previous colonoscopy was at 59 years old and was normal. The patient has no history of polyps or colorectal cancer, and none of the patient's siblings, parents, or children have a history of polyps or colorectal cancer. The patient is eligible for a screening colonoscopy. Reportable procedure and diagnosis will include G0121, which is colorectal cancer screening colonoscopy on individual not meeting the criteria for high risk. So this is not a high risk patient. And the next code will be Z12.11, encounter for screening for malignant neoplasm of colon. So G0121 is a HCPCS code. So we are using this code because the patient is a Medicare patient. And also G0121 is selected because the patient is not high risk. Another scenario: proctosigmoidoscopy. A patient with rectal bleeding undergoes a proctosigmoidoscopy. During the proctosigmoidoscopy, the physician identifies internal hemorrhoids. The proctoscope was withdrawn and the anus was prepped and draped. There was a prolapsing hemorrhoid in the anterior midline. This was rubber band ligated by applying two bands. In the posterior midline, there was another hemorrhoid that was banded in the same manner. So here in the picture you can see like what is a proctosigmoidoscopy and where it ends. It starts in the rectum and then it ends with the sigmoid colon. It doesn't proceed fully to the splenic flexure, end of sigmoidoscopy. So this is a small minor procedure compared to colonoscopy. So colonoscopy examines the entire length of the colon. Sigmoidoscopy examines only the lower third. If you divide the colon into three parts, the last part. So what do you think is the CPT code? 46221, 45300 hyphen 51 modifier is appended. 46221 is for hemorrhoidectomy internal by rubber band ligations, and 45300 is for proctosigmoidoscopy rigid diagnostic with the without collection of specimens by brushing and washing, separate procedure. Modify 51 is added because this multiple procedures are being done. One is the sigmoidoscopy and other is the hemorrhoidectomy which is being done. And procto means anus or rectum. Proctologist who specializes in this area, in this specific area. Test your understanding. Planned colonoscopy with biopsy is not completed to reach the cecum due to the tortuous colon. So you have four choices here: 4538052, 4538053, 4537852 and 45378 without any modifier. So which will you choose? You can even pick the codes like out of the four options which is correct based on the modifiers if you feel that is easier. So 52 is for reduced services, 53 is for discontinued procedure. Let us see the correct answer. 4538052. Modified 52 is being used because the scope did not reach the cecum. The reason being tortuous colon. So if you are appending modified 52 to a claim, remember to maintain documentation explaining why the procedure was cut short. The documentation should provide plenty of detail to allow the payer to make a reimbursement decision. So this is again another case study. So year old female presents with abdominal pain and anemia. Hematocrit 8.7. After being informed of all the risks and benefits, a consent was obtained for a colonoscopy. She has a history of gastric lymphoma 1 year ago. That was treated with chemotherapy and has shown no signs of return to date. Colonoscope was inserted without difficulty to the cecum. The ileocecal valve was identified. The appendiceal orifice was visualized. The cecum was normal. However, just above the cecum in the proximal ascending colon was a large circumferential mass with ulceration and friability. Biopsies and a photograph were obtained. Inspection of the remainder of the ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, and rectum revealed no abnormalities. The patient tolerated the procedure well. So, what CPT and ICD 10 CM codes are reported? So, here the colonoscopy is complete. It has reached the scope has reached the cecum. So, that is one point. And what is the reason for the colonoscopy? Patient presents with symptoms. There are different symptoms like abdominal pain, anemia, hematocrit is also low at 8.7. So this is a diagnostic colonoscopy, which is the correct option. 45378 C18.2 and D64.9, 45380 K63.9, R10.9, D64.9, Z85.72, or 45382 R10.9, D64.9, Z85.89, or 45380 K63.9, D64.9, C18.2. Okay. Hope all of you have checked your books and found the correct answer. 45380 K63.9, R10.9, D64.9, Z85.72. So this is a colonoscopy with biopsy. You choose the code 45380. K63.9 is disease of the intestine unspecified. And all the symptoms are coded here. We usually say don't code the symptoms. But if the definitive diagnosis is present, here the definitive diagnosis is not confirmed by the physician because the biopsy has been sent. Biopsies and a photograph were obtained. That's all. The results not yet back. So because of that, we are coding all the symptoms. And also Z85.72 is for the personal history of non-Hodgkin's lymphoma. So it's very important for you to find out what type of colonoscopy is being performed in the medical chart. What are the different reasons for this procedure? So you can divide the different types of colonoscopy into screening colonoscopy, diagnostic colonoscopy, therapeutic colonoscopy, surveillance colonoscopy. See, there are four types. Broadly, they fall into these categories. The definitions of all the four are given in the CPT book. Screening colonoscopy is provided to a patient in the absence of signs or symptoms. So, and based on the patient's age, gender, medical history, and family history, according to medical guidelines. So, it is defined by the population on which the test is performed, not the results or findings of the test. As such, screening describes a colonoscopy that is routinely performed on an asymptomatic person for the purpose of testing for the presence of colorectal cancer or colorectal polyps, because early detection of colon cancer has a very good prognosis for the patients. Diagnostic colonoscopy is performed when the patient has physical symptoms such as rectal bleeding or pain, and the test is necessary to either rule out or confirm a suspected condition. Signs and symptoms are used to explain the reason for the test. Therapeutic colonoscopy is performed when the abnormalities are treated for the purpose of biopsy, tumor ablation, or other therapy. Surveillance colonoscopy, so is when the patient is asymptomatic but has a personal history of gastrointestinal disease, colon polyps, or cancer. Technically, this is a screening test with different diagnostic coding and frequency guidelines. Surveillance is like the patient had colon cancer, which was surgically removed, chemotherapy was given. So then the patient will frequently come in for a colonoscopy once a year or twice a year. So whatever the physician decides. So that is a surveillance colonoscopy. You can check the book, the CPT book, where you have a colonoscopy decision tree. It's very important. Okay, where you divide the colonoscopy into two, like diagnostic procedures, therapeutic procedures. The codes are different. See if it doesn't reach the splenic flexure, and if it is a flexible sigmoidoscopy, 45330. Okay, that is a diagnostic procedure, sigmoidoscopy. For example, the same flexible sigmoidoscopy, if it is a therapeutic procedure, you will code 453312, 45347, that range, code range. So always decide diagnostic, or it is a screening procedure or a therapeutic procedure. Let us see a case study. A year old patient presents uh, to the hospital same day procedure unit for a scheduled colonoscopy. See, the age is not mentioned here. So you can assume like a 74-year-old or 64-year-old patient. The patient is informed of the risks and benefits and the possible side effects of the procedure. The proper authorization is obtained. The patient is moderately sedated with IV Versed by the anesthesia team. The patient is positioned and the colonoscope is advanced to the sigmoid colon. The patient was scheduled for a full colonoscopy to the ileocecal valve. Unfortunately, the patient had a poor prep and visibility beyond the sigmoid colon is impossible. The scope is withdrawn, the patient is awake and tolerated the procedure well. The patient will be rescheduled. So, what are the CPT codes, or if any modifiers are needed? You have four choices: 45378 74, 45378 73, 45330, 45355 73. So, the choice is like 74. 74 is a discontinued outpatient hospital procedure. Okay, ASC. This is after the administration of the anesthesia. 74 is used with the CPT codes. The patient, the procedure is discontinued after the administration of anesthesia. Because due to extenuating circumstances or those that threaten the well-being of the patient, the physician may cancel a surgical or diagnostic procedure after the administration of anesthesia. So the procedure code is mentioned with the if, addition of modifier 74. So this is used only in the outpatient hospital setting. So I'm just giving you the time to check the correct answer. Let us see the correct answer. 4537874. So because in the facility setting, the procedure is done in the same day procedure unit, and the procedure is discontinued after the administration of anesthesia. 74 has to be appended, and the patient was scheduled for a colonoscopy which is reported with 45378. The scope did not move after the sigmoid colon. Hope this is clear for you. Any questions, do get back to me. Okay, you can contact vCodemy Medical Coding Training for more detailed explanations and doubts regarding medical coding. Any topic you have a question, do address it to me. My mail ID is also shown here, and my phone number with the WhatsApp number is the same, 9944478988. Thank you for your patience.